Today I'm here with Dr. Anthony Plunkett, an anesthesiologist working in the military. He is from North Carolina. So, Dr. Plunkett, would you like to introduce yourself?
Yeah, hi. I think you did a great job. I've been in the military for over 20 years now as an anesthesiologist, and looking forward to hearing your questions and maybe helping some potential students interested in the field.
Alright, so let's get started with the first question. What drew you into medicine?
Well, for me, it was really a choice between law school or medical school, and I just found that in high school I enjoyed science classes more than anything else.
Cool. What does a typical day look like for you in the military?
So to be a physician in the military, it's a little different than being like a regular soldier in the military. We still have to do our job as doctors. So a typical day for me is I get into work around 6 o'clock in the morning or so.
Wow.
And then our first cases start at 7:30. And we do anywhere from 50 to 100 cases a day, and then usually I get relieved around 3 o'clock in the afternoon.
Was there anything that made you want to go in the military rather than just working at the local hospital?
Right, so for me, the military paid for my medical school, so I didn't have any student debt coming out of medical school, which is something I was attracted to.
What's one challenge in medicine that people outside the field don't really see?
Well, if I was thinking about medicine now at your age, I'd be really concerned about what are the potential impacts that AI is going to have on medicine in the next 10 to 15 to 20 years. And you really have to think about a field that AI cannot easily replace. And the other thing that I'd be worried about if I was your age is what's going to happen between physicians and what's called advanced practice physicians, like nurse practitioners and PAs. Like, are they going to become more autonomous and you don't really need the physician in the practice anymore? So those are the two things I'd really be concerned about that maybe the general public doesn't really see or think about.
That's an interesting way to look at it, I feel like. I think that AI is really going to take over the world in the next couple of years, and they're going to take so many jobs away. But the one good thing about AI, I feel like, is that it can never replace a human being, like working for you, giving you surgery. Maybe it could, but I feel like, personally, I wouldn't trust that.
Well, surgery is a hands-on profession, so it would be difficult. But think about a radiologist, for example. A radiologist never sees a patient, never sees somebody in person, really. Could a computer read a film better than a human being? And that's going to be a potential challenge in the future.
Yeah, for sure. Definitely will. Okay. Next question. What advice would you give to students who are interested in medicine but aren't sure where to start?
Well, I think what you're doing is a great start. Trying to kind of connect kids to potential areas of interest, whether it be in anesthesia or another part of medicine, and try to connect them with somebody who's actually doing it to see what it's like on a day-to-day basis. And then they, look at some videos, YouTube videos, and just read about what the day in the life of a physician is nowadays. TikToks, you guys all do that, right?
Yeah.
That's what I would recommend. Just trying to get experience as best you can to see if it's something you really are interested in.
Yeah, that's really good. Also, I was just wondering, what made you decide to go into anesthesiology? Was there any other specialties you were interested in?
Yeah, so for me, I kind of broke it down into, do I want to see patients every day and take care of long-term problems like a family practice doctor would do? So if you have like diabetes or high blood pressure, you would see your doctor every couple months and they would manage your problems. Or did I want to see patients quickly, next patient, next patient, next patient? And so I want it to be something a little bit more quick. And a lot of times that becomes anesthesia and emergency medicine. They usually see patients very quick and then they're on to the next patient. So that's why I chose that field.
Question. What are some of the common cases you see in the military?
Well, in the military, we have a very young population, which is different than most civilian hospitals. So a lot of things we see is bone injuries, fractures and stuff from military personnel jumping out of airplanes and then landing it wrong and breaking something. So we see a lot of what's called orthopedic injuries.
Cool. Was there any one experience that you had with a patient that you've impacted over time, like someone in the military, or maybe not so much because you kind of see them quickly and then you kind of move on?
Well, before your time, there were wars in Iraq and Afghanistan, and a lot of those soldiers were getting blown up with different types of bombs and stuff. And these young soldiers, 20 years old, 18 years old, would come back with their limbs would be gone because they'd be blown off, and they'd be in tremendous amount of pain. And so we really perfected the notion of what's called regional anesthesia, which is basically numbing the leg so that they're not feeling that pain of where it was blown up. So we did a lot of that in the early 2000s when the wars were going on. So that was impactful for me.
How many years did it take for you in training to see a patient?
So you go through 4 years of college, 4 years of medical school. To be a general anesthesiologist is 4 years of residency, and then I did what's called acute pain fellowships. So that was an additional year of training. So 4, 4, and 5 for me.
Wow, that's a great experience.
Yeah.
Okay, well, thank you so much, Dr.
All right.
Plunkett.
Thanks for having me.
Thank you for your time. Really appreciate it.
Hey everyone, thank you for watching our video.
For more information, check out the link in the description at healinghandsmentorship.org.
Click the link down below for our student interest form, or click here for more videos.